Welcome to Time for Health. I'm your host, Rachel Fall, and we're very glad you've joined us. Each time we get together, we talk about a different topic, just some health information to share with you, for you to pass along. And this time around, we are talking about what a wonderful, wonderful topic that has taken over our lives right now. COVID and all things surrounding COVID. And I am very, very lucky to have today Health Commissioner Jerry Bingham, Director of Nursing at the Health Department, Katie Crowell. Thank you both for being here. I am really grateful that you can be here because I know how busy you guys are, and I'm sure I've just glimpsed a little bit of what you guys have been through in the last year. So, gosh, COVID. We could kind of talk about everything from the beginning, but it was just so mammoth, and constant changes, I think, is probably the biggest theme, at least from the perspective that I was seeing, is just constantly learning and changing and doing things. So, where are we now? Like, what's the main thing that you guys are doing right now?
Vaccines. That is the main thing that we are focused on right now, and getting back to our new normal. I don't know that it'll ever be what we were used to before, but it's a new normal for us.
Because the health department does many other things besides handle pandemics. You do other immunizations and vaccines, and you do Narcan distribution and all kinds of things. So you're trying to maintain that throughout and get back to that.
Yeah, and we have actually not closed our doors one time during this pandemic. We have been full operation the entire time. And he can attest to our environmental health division. They have been busy, and then we, as the nursing division and public health information and all of that, we've been very busy, but we've also had our other jobs to maintain as well.
Right.
So
you got to keep that stuff going. You can't just, oh, sorry, we can't do any of that stuff. So talk a little bit about vaccines and where we are now. So it's April 2021 when we're recording this, but as with everything else so far, it's constantly changing. But talk about vaccines as it stands right now. What are they? How do they work? How does somebody get them?
So we have 3 different types of vaccines that have been approved for emergency use through the FDA. And that is our Moderna vaccine, our Pfizer vaccine, and the Johnson & Johnson. We started distributing our Moderna vaccine in December. It was actually Christmas Eve.
Oh.
Yeah, so Merry Christmas.
Yeah.
So we did that, and then we got Pfizer for a little while. We did get 1 round of Johnson & Johnson, and then
do you get to pick?
No.
You don't get to pick. You get what
you
get.
So we've been back to Moderna now for over a month. Okay. And the Pfizer vaccine is a 2-dose series, and that is scheduled 3 weeks apart.
Okay.
And then Moderna is a 2-dose series, and that's 4 weeks apart. And then Johnson & Johnson is one and done.
One time.
Yep.
So not only for vaccines is doing the vaccines, but then for 2 of them, the follow-up to the vaccines.
Yep.
Do you know how many you've done so far?
I can share that information. Well, I can tell you the percentage of our population that's been vaccinated, and currently we stand at 42.02. So over 40% of our population has been vaccinated.
And that's in the county?
Yep.
That is in the county. And we are looking at a population of 19 and under, that's 20% of our population.
Okay.
That's not approved for the Moderna yet, so we're trying to get Pfizer so that we can vaccinate the 16 and 17-year-old.
Okay.
So having said that, we still have about 40% of our population out there, just a little less, that's not vaccinated, that we really like to see a little bit more numbers if we're ever going to get the herd immunity.
Sure. Talk a little bit, gosh, I don't know what, okay, how does somebody sign up to get a vaccine?
So they can go to our website, go to ottawahealth.org, or they can go to Magruder's website, and there is an online sign up there, and it's super easy, takes about 5 minutes. You do name, date of birth, and then you sign up for your time slot. Really easy. It's a seamless process. It'll tell you the location and what time to be there, and for our vaccine clinics, we do not require you to bring your insurance information.
Okay.
So,
and you schedule your own appointment. You're not just calling somebody to say you're interested. You're actually scheduling your own appointment.
Yeah.
And you're doing them in a few locations, and it'll tell you which location.
Yeah. So we have so far used our office when we had very small clinics that were closed to the 1A population. So we were able to use our office. Then we outgrew that and we moved to Job and Family Services. They were very gracious to let us use their facility. And we did a lot of our 1B seniors during that time. It was fantastic facility, not a lot of walking distance into the building. Plus it was winter time and ice and snow and all that. So, but it was great for fitting 400 people in a day. But unfortunately, we outgrew that facility. So then Oak Harbor High School became another facility that we use. And that is amazing because we can get a lot of people through and we can really filter them through a pathway where there's no crossing over. So that has been fantastic. And we have also used Camp Perry. And that facility is amazing as well because you just make a loop through the building. And we have people in the parking lot at every facility to greet you, explain where you go, what the process is going to be. And then 15-minute waiting period is where you schedule your second vaccine.
And you do like 1,000 or 800 people or 1,000 people at a time, don't you?
Yeah, so the most we've done is 1,400 in a day. So it's nice to see that many people are interested in getting the vaccine because we know that it's new, as is COVID-19. It's not something that we've had before, so sometimes it's a little scary to think of, but we are amazed and we're so thankful for the amount of people that want to get vaccinated.
Yeah. Talk a little bit about that. I was going to ask about herd immunity, but it's a new vaccine, and I know vaccines over the years have waxed and waned in popularity or whatever, but can you talk a little bit about the testing and the safety and the efficacy and why it's important, that herd immunity?
Yeah, so the vaccines, COVID-19 vaccines for Pfizer and Moderna are mRNA vaccines. So there's very little ingredients in them. It's mainly salt, fat, sugar, water, and the virus is mRNA. So with these mRNA vaccines, they've actually been researched for many years now. This is just now their time to shine. So the pharmaceutical companies, they hire these researchers, and this is what they dedicate their lives to. And the research has been there through many different viruses, and they've said, this is our time, and then that virus kind of dissipated and wasn't time for the vaccine yet. But COVID-19 is the first time where they've really been able to utilize all of their research and hard work for these mRNA vaccines. And I know that it seems like it's gone really quickly, but in retrospect, I mean, there is all of the research that's been there. It was really just a matter of, okay, we extracted the mRNA, we know what the sequence looks like, now we're going to put it into our formula that we've been researching for many years. And thank heavens it took off, and we're here today.
It's doing pretty good. And numbers are going down. Cases, I think there's okay.
So our numbers have gone down a little bit today. But we have seen in the last 3 weeks where we've had a high incident rate, anywhere in the 70 to 80 cases per 7-day period. So we would like to see that number get down a lot lower. However, we're encouraged that the numbers are starting to go down again. So.
And we're still red. What does red mean, and how do we stop being red?
Well, red is just an advisory system. And just indicates high incidence of COVID. There are other indicators within that system as well. 7 different indicators, perhaps it's the number of people in a nursing home or a long-term care facility that has COVID. The rate of hospitalization, death, etc. I can tell you that we've been hitting 2 to 3 indicators. However, if we're ever going to come out of red, we have to get below 100 cases per 100,000 population. We were 2 cases away, literally about 3 weeks ago. 2 cases from getting below the 100,000, and then the number shot back up. And so therefore, we'll be in red for a little while.
Yeah, and it's not the numbers that we saw in November or winter time. It just is a little bit higher than what we've been used to recently. So.
And just continuing to do what we're doing is the way we
we have to vaccinate. So we have to vaccinate. We have to continue isolate or social distancing and wearing masks
and hand washing and all that good stuff. That
just as we've been doing the whole last year. So I think that a lot of this is some of it's our new normal that we are going to experience, but we need to get vaccinated. We need to get to that herd immunity so we can, kick this thing in the butt and get away from us.
Be done with it. Now, you said new normal. I mean, will we ever be back to, I don't know. I mean, just me personally, knowing what I know, I'm like, I will do things differently. I'm sure most people will.
One thing that we have learned is with the masks, our influenza A and B has been pretty much non-existent.
Yeah.
And do we credit that to masks? It could be social distancing, good hand washing.
Yeah.
So when we say the new normal, perhaps not just for COVID, for other diseases like the flu, influenza, A and B, perhaps masks will be the way to go.
Yeah, and I feel like more people maybe got vaccinated for the flu this year.
Yes, we did see an increase in our vaccinations for flu.
Yeah, I think we did too.
Yeah.
Yeah. So what kind of questions are you hearing from people, or pushback, or like what are things that you wish, you have an audience, I hope.
One thing that we have heard that myself and our epidemiologist have tried hard to dispel is the vaccine cannot alter your DNA in any way. All it does is some fat transports the virus's mRNA, so your body can recognize, hey, this is foreign to me, I don't like it, I'm going to build antibodies. But it in no way can penetrate into your cell's nucleus or anything like that to change DNA, anything. With all new things, change is a little scary for everything. So this is just a new type of vaccine that we're seeing. But we have vaccinated many, many, many people at this time. And the side effects really, it depends on the person, one, and if you've had COVID, some people that have had COVID, especially recently, they experience a few more side effects than what people that have not had COVID experience. I mean, it's inevitable. You can get a sore arm. That's the most common thing that we see. I got mine and I had a little bit of a sore arm, but we made it through. And, but some people, they do feel a little bit fatigued afterwards, might have a low-grade fever or some body aches. Those are all normal immune response. That's your body working hard to produce those antibodies to say, hey, if I come in contact with this, I am surely going to fight it off.
Katie, one of the other questions that's been coming up is people that's had COVID and they feel like they have enough immunity, should they still get vaccinated?
Yes, and so we're encouraging anybody and everybody, unless your doctor says, we have this, and this going on, we should probably wait for your vaccine. We are encouraging everybody to get their vaccine at this time.
Is there a window that they should wait after they've?
Yep, so the CDC says that as long as you're not within an infectious period with COVID, then you are able to get your vaccine. The manufacturers of the vaccine recommend you wait about 10 to 14 days just to give your body that chance to recover from the infection. And so, then you'll be able to produce a really good immune response for that. So we encourage everyone to get it. If you have any questions, you're always welcome to ask us, and we'll be happy to answer any questions. But if you have had COVID and you have had an infusion to help you with your symptoms, then you have to wait 90 days post-infusion for that. And that is just the manufacturer's guidelines for that.
Gotcha. The current vaccines, I can't remember which. One is for 16 and up and one is for 18 and up. Are there vaccines for children in the works? I'm sure there are somewhere.
So Moderna and Pfizer are both looking at the efficacy for children to see if and when it will be released for kids that are under the age of 16. So Pfizer is approved for 16 and up, and Moderna is 18 and up. So one thing, if you do come to our clinics, we will be checking age just to make sure that you are of the approved age for the vaccine. And we know that people are very eager to get their children vaccinated, and we're excited to see that as well.
And we're working hard to get Pfizer here. We've only been getting Moderna. So we're at the mercy of what the state provides. So we're looking at trying to get Pfizer so that we can offer the 16 and 17-year-olds the vaccine in our area.
Yeah, and
So-
Johnson & Johnson is also for 18 and over.
Oh, okay. I'm not sure I knew that. Okay. Now, if somebody, are you, is it very particular that it's just for Ottawa County residents, or is there a little bit of flexibility? Because we have a lot of visitors or neighboring places where they're struggling maybe to get it or whatever.
So this is a federal allocation, so it doesn't matter if you're from Ottawa County. Of course, we're encouraging our county because, we want everybody in our county to get vaccinated. However, we'll vaccinate anybody that comes to our clinic.
Okay.
And we honestly have had a lot of residents from other areas. We have had many visitors, but that's okay. We are happy to see people in the state getting vaccinated, and it's encouraging that people want this.
Yeah.
And they're willing to drive 2 hours.
That's, oh gosh, well, you know what? Yeah, if they're motivated to get it, absolutely.
They're experiencing the great view of the Great Lakes.
Right?
The new tourist attraction.
Yes.
Yeah, right. What other kinds of questions are you getting, or things that you would like to share or anything?
Well, we'll talk about the homebound. So one of the issues that's been coming up is what are we doing about the homebound population? And Katie has been working hard. We were trying to get Johnson & Johnson, so it would be a one-shot done situation, but because of the shortage of allocation of Johnson & Johnson in the state of Ohio, we're going to do Moderna. And Katie, perhaps you can elaborate a little bit more.
Yeah, so if we have anybody that's homebound in our area, we're encouraging them to contact our office and we can get you on the list. One thing that we do offer, though, is vaccinating in cars. So
if they come to one of the locations, okay.
That is the best thing for them if they want to get it sooner rather than later.
Okay.
Because with Moderna, we have to schedule 10 people at a time. We have to use a full vial.
Oh, sure.
And if we, geographically need to accommodate people, sometimes it's easier if they just come in the car. Let us know ahead of time when you schedule your appointment that, hey, I have mobility issues or what have you, and they need to be vaccinated in the car. We will gladly come out and vaccinate you, and then make sure that you're monitored for the 15 minutes. Yep. But if you are homebound or you know somebody that's homebound, we are more than happy to make those accommodations. We just can't make them as quickly as somebody.
Takes time.
Yeah, exactly. But we are starting that this week. So we have some people lined up to get their vaccine this week in their homes.
Okay. Any other last minute thoughts or things you'd like to share?
Well, so we've kind of hit a wall with the vaccination clinic, the mass clinic, so we just want to encourage people. We have plenty of vaccine now. It's the Moderna, but we just want to encourage people, sign up for these clinics, come out and get your vaccine so that we can get closer to that herd immunity.
Right. Is there a certain number that we need to get at?
The state has not released a specific number. It's been the $1 million question.
Right.
Unfortunately, there has not been a $1 million answer for that.
Okay.
So we are hoping it just gets
a majority, you would think would be,
We just want the numbers to keep increasing.
Yeah. And there's so many ways where people can, so many reputable, Billy Bob's COVID vaccine website is probably not where you want to go necessarily. So there's a lot of reputable, your primary care provider, the health department, hospital,
Just talking about providers.
Yeah.
Yeah, there's several providers out there too, so it doesn't have to be the health department, Mass Clinic.
Right.
There's the Kroger's, Bath.
All
those different pharmacies, Magruder.
Yeah, pharmacies,
hospitals. So there's several different places that you can go to get the vaccine now.
Yeah, and get your questions answered.
Yeah, and we encourage people, if you have questions at all, you can either contact us. We're more than happy to answer your questions for you, or the CDC's website is an excellent resource, and the Ohio Department of Health's website. A lot of our information on our website, that's where we directly get it from, and we have links there and everything like that.
And your website and probably Facebook page, we have discovered over the last year, that's just the fastest way to get the word out.
Yep.
Yeah.
And currently our website's undergoing a makeover.
So
stay tuned for our new website coming your way.
How exciting. Thank you again both for being here. It's a very, very important topic. Any last minute thoughts? I know I already said it once, but.
We cannot thank the people in this community enough.
Right.
The volunteers that we have had for these immunization clinics have been purely amazing.
It takes 20 people or?
It depends. We usually do one nurse, depending on the time period or the length of time for the vaccine clinic. We usually do one nurse per 100 patients that we schedule.
Okay.
So on our days that we have 1,400, we need 14 nurses. Health department staff does not have that many nurses.
Right.
So we are relying heavily on Magruder and our volunteers, and they have been purely amazing. Our parking lot attendants, our EMA has really rallied together to get a lot of people to help with the logistical side of things, because there is the clinical side, you know, administering a vaccine, but there's a lot of logistics that go into it, from the parking lot to checking people in to getting their paperwork. So truly this community has come together, and it's amazing to see.
It's an amazing community, and this has really been an opportunity to really strut our stuff in the midst of yuck, but yeah. Awesome. Thank you guys very much.
Thank you.
All right, so there you go. We're probably going to show on the screen, if we haven't already, some of the resources out there, some phone numbers and websites where you can get questions answered. It's a hot topic, and it's constantly changing. And I think the thing that we've all seen is just, you know, trying to get the facts from a place that knows the answers. So that's what we're trying to do today, is share that information. So take it for what it's worth, share it with people you know, and until we meet again, I encourage you to make time for health.